So did you know scars are just one of the body's ways of repairing itself? Sometimes it's from an injury or from surgery, and sometimes we're just born with them.
And joining us now is Beverly Hills board-certified plastic and cosmetic surgeon, Dr. Rady Rahban, to talk about how to treat existing scars, also trying to prevent new ones. Not always that easy.
Yep.
Rady, you were just saying that you would be a trillionaire if you could invent what?
Three things that people spend most of their money on is trying to get rid of stretch marks, trying to get rid of cellulite, and trying to get rid of any scar, whether that is from a C-section or gallbladder, et cetera. And to be honest with you, there's very little to almost no science behind the stuff that's being advertised, and therefore I would tell you, for the most part, save your money.
So what do we do with scars? We know if you're going to go into surgery, which you do a lot, you do tummy tucks and breast augmentation and all kinds of stuff, you're going to have a scar, right? You just have to accept that?
100%. So there's this idea or notion out there that there's such a thing as scarless surgery. Oh, I'm going to go to a plastic surgeon, so there's no... First of all, anytime a scalpel hits your body, you have a scar.
Yeah.
So what you're trying to accomplish is a really a good scar, a beautiful scar versus an unsightly one. So you want it to be thin, flat, narrow, and light, right? As opposed to thick and wide and dark and raised. So this idea that it's not going to exist is nonsense. You just want to make sure that it's a good scar that's concealable versus one that's obvious.
So you just talked about, I guess, ideal scars and bad scars.
Correct.
What is a mature scar?
So, so if you had a surgery 12 years ago and all of a sudden you decided, you know what, I want to get rid of it, there's no way to get rid of that using lasers and creams, et cetera. So the time frame that you have to work on a scar is when it's still healing. So that would be the first 9 months or so. A mature scar is a scar that's healed, it's done, it is whatever it is. I had a child 5 years ago and my scar is the way it is. So, you don't want to spend a lot of money there. There you need to cut out that scar, close it again, and then you begin regulating and trying to make it move from bad to good.
So, a lot of people don't have surgery. I dorked and burned my forearm on the oven cooking cookies one time, and the scar is still bad 6 years later. There's nothing I can... I mean, it's not raised or anything. It's just I have dark skin.
Right. So there's three things that I think this is like, aside from the $1 trillion being spent. First thing that really helps is, we used to use silicone sheets on burn patients, particularly in children and things of that nature. We don't really know the science exactly, but we know silicone works. So people don't like the sheets. They're very cumbersome. So they move to liquid silicone. So when you're buying scar cream...
Yeah, I was going to ask, like the Mederma, does that stuff work? Or
the ingredients,
and
when you turn over the ingredients and it has acai berry, desert sand, the last ingredient is silicone. So the silicone is what's working. So they melted it and made it liquid. The second, so silicone works. The second is, believe it or not, is pressure. So the best thing you could do for any scar while it's healing is massage it.
Oh.
So take whatever salve you like, Aquaphor, Vaseline, whatever, and gently but pretty consistently keep massaging your wounds. And what that does is it causes the collagen to form a nice layer instead of getting all jumbled and becoming irregular. So really very powerful. And the last is a little bit of tape, if you put tape on it. These things are all very inexpensive and quite doable for anyone when they're recovering from a burn or they had a C-section or et cetera.
I have a question. There are some lasers that work on dark scars, but how come nothing works on a white scar?
Okay, so lasers is this whole area. The truth of the matter is lasers are great for color. So they take pigmentation and they remove pigmentation. So if you have a scar that's pigmented because you turn to be dark, you could consider it. But you can't get white to go away because that's the end color. So, you get to, so when you're...
Could you tattoo it?
You can. So there's cosmetic tattooing that adds pigment to your white scar, which then gives it the illusion that it's like makeup. So, lasers in general are good for color. But if you have a thick scar, or a raised scar, or a keloid, or hypertrophic, lasers, you can do 20 rounds of it, and you're going to say, God, I think that looks maybe a little better. It's not better.
So don't spend the money on that.
Don't save your money on other. That right there is a hypertrophic scar. Exactly.
Okay, so important. You have a podcast. It's called Plastic Surgery
Uncensored.
We have a quick clip, an audio clip from it. Let's listen.
So this idea of no scar, what do you mean there's going to be a scar? You're a plastic surgeon. That's the whole reason I'm here. I'm a plastic surgeon. I'm not the Messiah. I can't not leave a scar.
So when does your podcast, where is it? And
So you can find it on all the major podcast platforms like iHeart, Apple, etc. It's basically the purpose of it is to give people real information because everyone's concerned to some degree about these very important cosmetic concerns, and the question then becomes is what's real, what's not. And how do I avoid becoming, some marketing ploy? So that's really the goal of the podcast. It's out every Wednesday, and I hope people tune in and learn some basic information.
Plastic Surgery Uncensored. Dr. Rady Rahban, thank you.
Thanks for having me.
We love our scars because it means we've lived on
Yeah,
this
we've
path.
lived. That's called denial.
Yeah, I don't know if I
we're,
love.
we're so wise. We've had so many years
I have a
on
couple
Mother
scars
Earth.
underneath my chin from
Yeah.
being dropped as an ice skater. I don't know if I love those.
No.
Yeah.
I'll learn.
I've never noticed them ever.
Yeah.
Yeah,
I'll
but
show
that's the
you
difference
them.
between women and men. You guys have makeup.
Oh, that's
So
true.
if the scar is,
Men here wear
if you have a
makeup.
nice scar, you can wear makeup.
All right.
Okay.
Thanks,
Thank you.
Ryan.